The first day I volunteered at the clinic, I was working at the front desk, and there was a patient that came in, and he told me that he was a diabetic and he hadn't had insulin for almost a year. And he was unable to keep his job, and he was barely able to make ends meet, and he had no access to insurance. And when he left our clinic that day, he just looked at me and he said, "Thank you for making me feel valued. Thank you for just caring about me. No one has cared about me in the longest time."
Working at the Student Outreach Clinic has really opened my eyes to the burden of untreated chronic medical conditions and the impact of just a few hours would have on these individuals' lives.
The contra-coup contusion tends to be larger, much more severe, much more significant.
As you go through your first year and also in your second year, you're somewhat removed from patient interaction. And I felt that I needed a renewed interest in my desire to enter into medicine.
We might have to be a little creative in how we do the exam room.
The idea of starting a clinic where we could see patients really over the course of our career, as we felt that was a great way to kind of renew our interest and really make a difference in this community.
Sometimes students come to you with ideas and you listen and you said that you will help them, and 2 or 3 days later the idea is gone. And I was really astonished how they stuck to their idea and spent a lot of time developing this concept and developing the facility.
We first did a community needs assessment where we looked at the patients that come to the emergency department without a physician. We found that those zip codes on the west side were definitely in need. And we met with the South Bend Heritage Foundation, our community partner now, when they suggested they have a space at the Marycrest building, which is right smack dab in the middle of where we wanted to place this clinic.
Western Avenue is in a neighborhood that is, I think, in desperate need of those kinds of services that the clinic provides.
We receive no money from Indiana University.
South Bend Medical Foundation is providing all of our supplies for the lab.
80 to 90% of the things that we have at our clinic was all donation from hospitals, local physicians, various businesses. St. Joe Regional Medical Center provided us with all the exam tables, various office supplies and equipment, and then Memorial Hospital provided us with most of our furniture, and they also provided us with a very big monetary amount. Very busy people took the time out of their day to help us and make the process very easy for us.
When you have a group of young individuals who are in the process of becoming physicians and they are very passionate about something, it's hard not to get excited with them and for them.
We are still medical students, so we need someone to overlook everything that we do. We cannot run without a supervising physician.
It's a lot of fun. It's not a lot of work because it's low volume and I'm not doing the work, the students are.
My name's Luke Collins. I'm a third-year medical student working here at the South Bend Student Clinic.
We are in charge of the patient from the time they walk into the door until they leave. We have to draw the blood, collect the appropriate labs, even mark what labs we want to get, and we have an EKG machine there as well.
It's really an excellent test. You get to teach, which is fun, and just interacting with students is enjoyable.
We very much appreciate the volunteer physicians that we have and really appreciate the opportunity to work with them, not only in their teaching role where they can be educating us, but also just to talk one-on-one with them sometimes.
People took time out of their schedule to train me, and if nobody takes time for them, how they can learn?
It's a different education, whoever comes in off the street, and they have to react to that problem. So that's an experience which they don't usually get unless they're in their residency.
These are our patients, and that feeling really brings a sense of reality to the situation. Especially when we go back to our studies, there's more of an imperative to really pay attention to what you're learning.
Tell me a little bit about what brings you in today. As a first-year medical student, I performed phlebotomy. I took full patient histories and vitals. I entered data into patient medical records.
I feel like I'm ahead of the game because I understand electronic medical records.
We have teams here, so Meredith and Edmund, exam 1, exam 2. I'm a third-year medical student. I'm working in family medicine. I'm learning that part, but I'm also asking, what's the personnel like? What kind of meetings are you having with your staff? How can we best learn about workflow? So really I'm having a deeper experience, more than just medicine.
So as a fourth-year student, one of the most prominent things on my mind is getting a residency position. Something that is very important in residency is to teach younger residents and other people that you're working with things that are important to your profession.
What kind of took my breath away was when I saw 4 first-year medical students, and they were in there actually seeing patients. So this is the needle that we're going to use. From a student perspective, from first year all the way, if you stay till 4th year, you can see the same patient if you want to over those 4 years. To really see them have that experience right up front was very exciting to me.
It means a tremendous amount to our community.
Patients that they come in contact with are the underserved, and they oftentimes end up in our emergency room, and that's not the best setting for them.
This is a place for them to come to get long-term care if they want to, or if they would like to get connected with the actual healthcare system, we can find ways to get them connected. When I move on to residency, I will always look back at the clinic with a sense of pride as an achievement.